trying to explain to my 3-year-old son that mom has to go away for a while, and he's asking why.
I'm Rosemary Green, and this is Life Jolt. It's a CBC podcast about women in the correctional system. You'll hear our struggles.
Like, they're denying me human contact.
And our successes.
He had his crib, he had his mom, he had his toys. It was amazing for everyone, even the guards.
Available now on CBC Listen or wherever you get your podcasts.
This is a CBC podcast.
It is time for Ask Me Anything, the COVID Q&A edition.
Ask me anything!
If you're fully vaccinated, there's a lot that you can do now with a lowered risk.
We're hearing a number of other jurisdictions that are starting to see struggles as they deal with the Delta variant.
The Delta variant is spreading readily among people who are unvaccinated. So even countries that have high percentages, remember, the entire population is not yet vaccinated.
It has been several weeks of mostly good news as we continue our way through the pandemic. Daily case rates are down across most of the country. Vaccination rates are up. But a couple of news items are generating questions and some concern about whether this pandemic or where it could be headed. New modeling was released this week by the Public Health Agency of Canada, and it comes with some warning flags for the fall and winter. The Delta variant might be threatening the progress we've made in this pandemic. And we have new public health guidelines this week for those of us who are fully vaccinated. So if you have 2 doses, you can hug again without a mask, or it's more complicated than that. You can hug certain people in certain situations. Nothing is clear cut with this pandemic. And we have an expert to help us sort through a week's worth of pandemic news and answer your questions over the less than half an hour we have left. Dr. Alex Wong is an infectious disease doctor at Regina General Hospital. He's also an assistant professor of infectious diseases at the University of Saskatchewan, and he is here to take your calls and answer your questions. You can ask him anything about COVID-19, so call us now, 1-888-416-8333, 1-888-416-8333. Dr. Wong, thanks for joining us.
Always a pleasure, Ian. Thank you.
I actually first, though, want to ask you a question that is more related to the first 90 minutes of the program as opposed to COVID. The Cowessess First Nation is about a 2-hour drive east of you, and I know you have, through your practice and just generally in your life, taken the time to become very aware of Indigenous issues. What was your reaction when the news came out of Cowessess First Nation?
Yeah, it was heartbreaking to hear the news of the 751 unmarked graves. It's just tragic. And, without really kind of getting into too much of, the political piece or anything, we see, the downstream effects of colonialism and, the residential schools and historical trauma every day in our clinic. There's a disproportionate number of persons of First Nations, Indigenous, Métis heritage who we see who are affected with infectious disease, and that's not just COVID, that's things like HIV, viral hepatitis, and addiction, so forth. And again, a lot of this is just some of the unfortunate and tragic downstream effects. And so we obviously have a lot of work to do. And again, I am still myself trying to find my way. I was far more ignorant 2-3 years ago until I really made a concerted effort to understand and learn our history, and I was shocked. So we all have much work to do. It is tragic, and we need to really let our First Nations leaders lead us forward, in the spirit of truth and healing and reconciliation.
Yeah, I could talk to you, Dr. Wong, a lot more about that, including the ways that you learned a lot more about this and the way it changed you as a person and as a doctor. But that is for another show, because I do want to get to the COVID questions and answers, so people can call us at 1-888-416-8333. Before we go to calls, I'm just going to ask you a couple of questions that we have. And about the Delta variant. There was some modeling from Public Health Agency of Canada about the impact the Delta variant might have in the fall. How concerned should we be?
I've kind of tried to message cautious optimism, but at the end of the day, I think we're going to be okay. Okay, meaning that if you're fully vaccinated, the protection, even with one dose, but especially with 2 doses against the Delta variant, both in terms of getting infected, but also most especially against hospitalization, severe illness, and death, is extremely high. And so, we know that Delta is very transmissible. And so, there's obviously a lot of worry that it will find, pockets of individuals who are unvaccinated, and we know that persons who are unvaccinated are definitely going to be at higher risk, and that probably sometime between, late August to late September, it is going to be the dominant variant across the country. Here in Regina, there's some internal data, and we're already at about 50%. And so, this is going to be what we're going to see. And it's really going to be a tale of sort of 2 settings. One is going to be persons who are fully vaccinated, and the other is going to be, persons who are not. And we're going to see outbreaks in individuals who are not vaccinated.
Dr. Wong, I have some other questions for you, but I'm going to jump to calls because we have so
Absolutely.
many of those. And when the callers ask their question, feel free, Dr. Wong, to just jump in and answer. And our first call is from Winnipeg. Mary Pettick on the line. Hey, Mary.
Hi. Couple of questions. Number one, why is it healthcare workers don't have to get vaccinated? In order for me to go into a long-term care, I likely will have to be double vaccinated in the future.
Mm-hmm.
Secondly, does the Delta variant affect seniors in the same way? And lastly, will we have vaccines for hybrid variants of COVID? Will it just become a way of life?
All right, Mary, so you managed to squeeze in 3 questions. Maybe we'll deal with those in reverse order, Dr. Wong. So first of all,
okay.
The people who are double vaccinated, pretty high level of protection. But what about, if I understood the question correctly, variants still to come?
Yeah, so we know that the virus is going to continue to mutate. We know that there's going to be new variants. There's already sort of discussion around the so-called Delta Plus variant, which has been found in a number of different countries across the world. And so, right now, the evidence would support the fact that, being vaccinated twice with any sort of approved vaccine, at least here in North America, but particularly the mRNA vaccines, appears to provide very robust protection, both against getting infected with variants as well as getting severely ill and being hospitalized. We obviously know that this might change. We have no way to really predict exactly what the future is going to look like. But, we were really kind of worried about Delta, and, it looks like the vaccines work extremely well against Delta. So I guess that was question 1. Do you want to give me question 2 real quick?
Yeah, well, as if I remember correctly, I'm actually doing them in reverse order. So, but question 2 remains the same, whether you go forwards or backwards. I think Mary was asking whether the Delta variant, yes, exactly, is that are seniors more vulnerable?
Yeah, and so the short answer is yes, in the sense that seniors are going to be more vulnerable than younger individuals or persons that have no medical problems or medical history. At the same time, vaccines work tremendously well for everyone, especially and including seniors. So if you're fully vaccinated, again, there's definitely the potential to get infection in rare circumstances, but even if you're unfortunate enough to get infected, if you've been fully vaccinated, the likelihood that you're going to get severely ill is extremely low.
And the reason I left Mary's question, I'm sorry, did you still want to talk about that, Dr. Wong?
Nope.
So the reason I left her first question to last is that it really is a policy question more than a medical question. But what she wondered is, why are provincial governments not mandating mandatory vaccinations for healthcare workers? And although you're not responsible for that policy, I suppose, in the hospital setting, I don't know, are you seeing vaccine hesitancy? Is that an issue?
There definitely is. It's hard to know exactly how much of that there is, but certainly in the long-term care setting, we know that hesitancy exists, and that's universal across, I think, all long-term care settings. I know there's been discussions in certain provinces like BC, for example, around mandating vaccine for long-term care workers. For me personally, I think it makes a lot of sense to be thinking about, especially if all of the other strategies that we have and that we attempt to sort of put in place to address issues around hesitancy in healthcare workers is not successful. I think, again, we have at a system level a responsibility to protect the patients and the people that we serve. Obviously, there's some challenges, again, from sort of the policy and the political perspective around the idea of forcing or mandating vaccines. And, so that's probably where some of the contention actually is.
It is amazing to me, Dr. Wong, how well infectious disease doctors know these files and how good you are at answering the questions.
We try.
Here's one on social media from Marcy B. She says, I received AstraZeneca for both shots. I had zero symptoms, no fever, no chills, not even a sore arm for both shots. My question is, do I still have great protection or just minimum against the virus because I had no reaction from the vaccine?
Great question, Marcy. So the short answer is that the fact that you either do or do not have side effects sort of post-vaccine is in no way, shape, or form indicative of the amount of protection that your body is mounting. And so the short answer is you shouldn't really be worried about it. Again, everybody is going to be different, and there's no simple way to really predict who's going to get side effects and who isn't. Having 2 doses of AstraZeneca is excellent protection, and so well done. Nothing to worry about.
On a personal note, Dr. Wong, I had AstraZeneca first, nothing, not even a sore arm. I had Moderna yesterday, which was actually kind of stupid on my part, bad timing. And so far, no symptoms, but I keep waiting. Like every time I feel a little odd, I think, uh-oh. But anyway, the show's almost done, so I made it this far. Donald Protz on the line from Thunder Bay, Ontario. Hi, Donald.
Hi,
Donald.
Good afternoon. Hi, doctor. My question is about the efficacy of the vaccines that I got. In April, I had the Moderna, and 5 days ago, I had the Pfizer. And I know they overlap on the way they attack the spike protein. And I'd like to know if the efficacy is boosted up, if it's at a fair level. And I'm still experiencing some side effects from the Pfizer.
Sure. So thanks for the question. So in a nutshell, again, I mean, hopefully your side effects are going to resolve in the next couple of days. That's what we would expect. And yes, your protection with 2 doses of an mRNA vaccine are excellent. There was obviously a lot of angst over the last kind of 7 to 10 days, especially because there was a bit of an issue or a blip with our Pfizer supply here in Canada. So as a result, there were a lot of clinics that were expecting to get Pfizer who then had the Moderna vaccine. So there's been a lot of messaging around how Pfizer and Moderna mRNA vaccines are essentially pretty much exactly the same. They work exactly the same. The same sort of coding is used to sort of generate the mRNA that the vaccine contains, and that, yes, you can mix and match Pfizer and Moderna safely, and that you don't lose any sort of efficacy per se when you have, a first dose of one and a second dose of the other. And there's been some high-profile people like our, public health lead in Canada, Dr. Theresa Tam, who posted on social media, I think just either yesterday or the day before, that she herself actually had a first dose Pfizer and a second dose Moderna. So if it's good enough for her, it's going to be good enough for all of us as Canadians. So the efficacy is excellent, again, both against infection as well as hospitalizations and death. With this Delta variant, based on the real-world UK data that we're seeing, there's about an 88% protection against symptomatic illness with this Delta variant based on the United Kingdom data. And looking at hospitalization, severe illness, and death, you're looking at a number of 96% with 2 doses of mRNA. And that's 14 days after your second dose. So great protection and great job getting your second dose, Dawn.
Trying to explain to my 3-year-old son that mom has to go away for a while, and he's asking why.
I'm Rosemary Green, and this is Life Jolt. It's a CBC podcast about women in the correctional system. You'll hear our struggles.
Like, they're denying me human contact.
And our successes.
He had his crib, he had his mom, he had his toys. It was amazing for everyone, even the guards.
Available now on CBC Listen or wherever you get your podcasts.
This is a metaphor for your business's journey. Sometimes it feels like you're going 100 miles an hour, barely keeping up. But to cruise through challenges, you need someone who's right there with you. That's what Dell Technologies advisors do. They have the tech advice you need to get past whatever's in front of you and get to where you want to go. For advice on solutions like XPS 13 laptops powered by Intel Evo platform, call an advisor today at 877-ASK-DELL.
Infectious disease specialist Dr. Alex Wong is here this half hour to answer your COVID questions. Dr. Wong, a social media question from Catherine Agar. She says, I told a friend today that I look forward to not wearing a mask once I'm past the 2-week double vaccination date, and they responded, I won't be allowed into stores. Am I interpreting the latest guidance incorrectly?
So no, Catherine, you're not. At the same time, again, it's a bit complicated because every jurisdiction in Canada is different with regards to sort of a masking mandate and so forth. So, for example, in Alberta, I think Alberta is going to be the first province literally to remove every sort of public health sort of restriction and the masking mandate as of Canada Day, which is, I think, this Thursday. And Saskatchewan's going to follow suit in about 10 days. So I'm not completely familiar what the guidance is going to be for other provinces, but I think Alberta and Saskatchewan are definitely pushing the envelope quicker than any other province. And so there is going to be a bit of individual sort of case-by-case basis based on where you live in the country as everything slowly kind of opens up. But again, I mean, the public health guidance that was issued just on Friday, nice graphic that really kind of in simple terms illustrates what's safe and what's not. It's going to be, I think, once your particular jurisdiction, Catherine, says that there's no need for masking, it's going to be really up to you, I think, whether or not you choose to continue to mask, for example, in indoor public spaces or not. But if you're fully vaccinated and you're 14 days out from that second dose, your risk obviously drops dramatically for getting COVID.
But this is a complicated country, Dr. Wong, as you know, politically. So you have PHAC, the federal agency, has its guidance, but really, for the most part, it's just guidance. As you point out, you have provinces that are responsible for health rules within their jurisdiction. But then you have municipalities. I saw, and I just don't know at hand whether this is the case or not, but when we reported what Alberta was doing a few days ago, somebody quickly said to me, but certain cities in Alberta will still have, for example, mask mandates. And then the third level is, at the end of the day, a store is private, and if they require you to wear a mask in their store, and who knows why, maybe because they have a vulnerable employee and they're not sure who's vaccinated or not. Ultimately, I think they can set the rules about coming into the coming into their store or not. So it is all complicated. Listen, there was one other thing in that question, Dr. Wong, that I was curious about. She talks about 2 weeks after the second vaccination, but I've also heard 3 weeks. Like, what's the safe zone for when your immunity should be boosted from that second shot?
I think most, people who are smart would probably say kind of in around the 10 to 14 day range is kind of when, you will have sort of reached a point where your immunity's been boosted quite strongly. Obviously, as you kind of move forward, you're going to get some increased protection. But we know that, your antibody levels, especially with the mRNA vaccines, rise quite vigorously in the first couple of weeks. But, especially in the first few days, we would still, again, suggest a degree of caution.
To the phones now, and in Ottawa, Carrie Mangy in Yellow is on the line. Hi, Carrie.
Hey there, how are you?
Good. What's your question for
Carrie.
Dr. Wong?
So I'm a mom in Ontario. We've experienced a very, very long lockdown with kids stuck at home learning online.
Sure.
And so we've been really paying close attention to the rules and following them. And both my husband and I are both double vaccinated. And but we have friends and family from outside of the province. And as you can imagine, being an interprovincial family, it's been a really long time. And my kids are missing their grandparents and friends and family. And so anyways, my question is about how best to gauge the risk level of having friends and family from outside of the province. One of those provinces being Saskatchewan, lifting their restrictions very soon. We're surrounding ourselves with people who are vaccinated, fully vaccinated, but because our kids are young enough that they can't be vaccinated, I'm just wondering if the vaccine protects us from getting sick. Does it protect our kids from, what's the likelihood of someone bringing COVID to our house if they're fully vaccinated?
No, and that's a great question. And so I think the short answer here to simplify things for you is that regardless of where people are coming from, short of, and I mean, obviously things can change because we have no way of knowing, what the numbers are going to look like into the sort of the late summer and early fall. But right now across Canada, things are pretty quiet and the amount of community transmission is relatively low, certainly much lower than, in the last 2, 3, 4 months when we had our big surges. So I think the short answer here is that if you're bringing seeing people from across the country. Summer is a great time to do it. Just with the seasonality of SARS-CoV-2, the risk is going to be much lower. And at the same time, if everybody is fully vaccinated, two doses of approved vaccine, 14 days out, again, the likelihood that those individuals are going to be sick and bring COVID into the house, with your kids, it's going to be very, very, very low risk. And so, I think the guidance from PHAC would probably be sort of when you look on this chart that, again, provided that everybody's comfortable, it's actually more of a question for the adults and whether they're comfortable, sort of interacting with your kids who seem to also be taking a lot of precautions but are not vaccinated. So if everybody's comfortable in that sort of situation, it's probably reasonable to go ahead and get together indoors and, to hug and to do all those types of things that we all need to do as families, and we've missed so much over the last number of months.
And Dr. Wong, this next question on social media kind of touches on the same topic, but a slightly different perspective on that. Anne DeRoche asks, my daughter's getting married in August, and we hope to invite 50 guests. I have 2 members of the family who refuse to get the vaccine. Should they attend the wedding?
Great question. And so, Anne, I think at the end of the day, it is your decision to make regarding whether or not you would like to have people, who are not vaccinated, attend the wedding. I think so for people who are not vaccinated, sort of mixing with people who are vaccinated, again, if you're talking about 2 unvaccinated individuals and 48 fully vaccinated persons, the overall risk is probably going to be very low to everybody overall. So that would just be my first comment. I probably would think that something like that would be pretty safe. But at the end of the day, there's an individual level of risk tolerance here. And so, ways to sort of keep things safer is to try to have as much happen possibly outdoors as possible, try to minimize, sort of what takes place indoors. And again, you might want to potentially sort of cohort those 2 individuals with certain other individuals who are safe or comfortable in interacting with them and who are fully vaccinated. So again, those are just some practical ideas around how to do things, but it really comes down to you and your daughter making a decision around, how to do this. But it probably should be pretty safe. It's relatively small numbers.
We've had the kids' table at the wedding. Now we're going to have the non-vaccinated table at the wedding as well. We'll see how that goes. We have less than 5 minutes, so I'm going to try to squeeze in maybe 2 calls, but it'll mean quick questions and fairly quick answers, although your answers have been quick. Mike Zukowski is in Thornhill, Ontario. Hi, Mike.
Hi, Ian. Great job as usual. Going to miss you when you leave. My question is, how are the officials going to determine if I'm going to get a booster shot? I've already got 2 Pfizers. And the reason I'm asking this question, I had whopper symptoms after I received my second dose of Pfizer. I was out of action for a complete day. Chills, fever, slept. And now I'm over-concerned if I'm going to be over-vaccinated.
Well, I don't think you can really be over-vaccinated. I mean, I don't think you can kind of have too many antibodies. I think, right now, there are studies definitely ongoing regarding, what a booster looks like for people that have had 2 doses already. Most of those studies are really focused on individuals who are, for example, immunocompromised or who are on immunosuppressive medications, for example, where we're worried that maybe they're not going to mount as vigorous an immune response and whether a 3rd dose is going to be valuable to them. But certainly with, this pandemic becoming endemic, something that we're just going to live with over time, the idea of boosters, perhaps even tailored to different variants and what we're seeing circulating across the world, is certainly a reality, but there's no real sort of understanding as to what that's going to look like quite yet. 2 doses looks to be good for, at least 9 months plus.
And Dr. Wong, let's go to our last call now. Don Nadurek is calling from Toronto. And Don, short on time, what's your question?
Hi, thanks a lot for taking my call.
You're welcome.
I'm a senior. Don. And following government advice, I'm double vaccinated with the AstraZeneca vaccine. But of course, since that happened, it's now proven to be not as effective as the mRNA vaccines. And I'm curious about a booster shot, really, if there's consideration being given to those of us who are double AZ'd getting a booster shot of an mRNA vaccine. Thanks very much.
Great question. So again, I know that there are studies ongoing sort of looking at boosting with mRNA individuals that have received, doses of the so-called vector vaccines like the J&J vaccine and the AstraZeneca vaccine. Right now, all of that is still very preliminary, and so we don't have results from that data in any way, shape, or form. So until we see some of that, I think that's not really going to be something that's going to happen. That being said, you mentioned here about how AstraZeneca does appear to be less efficacious, compared to, for example, the mRNA vaccines. And there is a bit of a drop, it's about probably a 15-20% drop in terms of protection against symptomatic infection, say with something like Delta. But it's worthwhile pointing out that 2 doses of AstraZeneca is still extremely protective against hospitalization, severe illness. With Delta, the UK data would suggest like 92-93%. So, that's kind of 92% versus 96%. So you're still very, very well protected, and 2 doses of AZ is a great option.
Dr. Wong, we have just under a minute. Let me ask you this. As always, your answers are clear and they're based on evidence. But the other thing I'm noticing is I feel like a little bit of optimism. If I talked to you in March, you were really concerned about the third wave in Saskatchewan in March. But am I right? Are you feeling kind of optimistic as to where we're at right now?
I really am. Ian, it's been a really long few months, I think, for those of us here in southern Saskatchewan, just with what we've had to deal with, and for many around the rest of the country. But honestly, vaccines are just killing it. Like they're so good. They are just better than what we possibly could have imagined. And they are totally decoupling cases from hospitalizations and deaths. And so, there's a part of me which is still anxious because I'm worried about those people who are not vaccinated and what those outbreaks are going to look like. But we can only do so much. I think for the vast majority of persons who are going to be fully vaccinated, we are fortunate enough to be in a situation where life is going to return to a semblance of normal, probably quite soon. And we are going to have outbreaks, but it's not going to threaten our hospitals and ICUs the way that it had that it did in March and April.
As always, a terrific job, Dr. Wong. Thank you very much for being on the show.
Such a pleasure, Ian. Thank you so much for the invite.
Dr. Alex Wong is an infectious disease doctor at Regina General Hospital. He's also an assistant professor of infectious diseases at the University of Saskatchewan, and he is in Regina today.
For more CBC podcasts, go to cbc.ca/podcasts.